If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding, unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty.
If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Excellent. Just going to lift your legs up. Is that okay? Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. So just going to apply this dressing to the feet. Okay. Want to take your hand away? Well done. Okay. Can you put that for me? Excellent. Look at this. Okay. Check the circulation by pressing a nail bed or skin beyond the bandage for 5 seconds. Release the pressure. And if the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Looking at this. Okay.
Immobilize the area. Bandage the bite area with a compress, leaving enough room to insert a finger between the bite and the bandage. If the bite is on or around the hand, remove any jewelry, as swelling may occur. Alert emergency services and follow their advice. If the bite is venomous, do not attempt to suck the venom out.
Go side to side, put their head on your shoulder, and then you're just going to go down together to your knees, and then you're just going to lay her down. There you go. Always be careful of their head. I know you saw Hannah has control of herself right now, but you really want to make sure their head doesn't hit the ground hard. And then you're going to want to go into recovery position. So you're going to bend their knee and just kind of roll it over. That way, if she has any fluids or if she's vomiting, everything can just kind of like roll out of her mouth and she won't choke on it. If you have access to any kind of cold compresses, ice, cool cloths, you want to do that, put it on their forehead and behind their neck. Keep them down for a little bit and then slowly get them up. And you do it little by little. There's no race. So you just slowly help them up. You can go underneath the arm and have them, and then just have them sit for a little bit. Make sure they're okay. They may start to feel faint again, and if they do, you just roll them right back. You just nice and easy. There you go. And the same thing over to the side. If they continue to faint, you're going to want to call for help because something else could be going on. Oftentimes, whatever's going on will resolve itself after you have the person down and they've recovered. Sometimes it won't. You need to look for other things. You need to make sure that they're breathing. You need to make sure that they have a pulse. Sometimes people have other medical conditions that you don't know about that could interfere with what's going on with their consciousness. So you're going to need to call for help.